When is too much estrogen not a good thing? Welcome to the weekly newsletter. I'm Dr. Sunny Dhesi, and I have got some interesting things for you to listen to today. Pause there for a moment. When is too much estrogen not a good thing? That is one of the things I wanted to discuss today, and this is a condition called tachyphylaxis, and it's with HRT. So basically, you've got these really high doses of estrogen, but as part of your perimenopause, menopause management, maybe it's patches, maybe it's gel, increasing doses of it, but you're still getting menopausal symptoms, and that is tachyphylaxis with HRT. So I'm going to discuss that in a moment. But first, I want to have a little rundown in clinic about what's been going on. So what's been going on in clinic? I think the tagline for this section of the video, the newsletter as you're watching it, is exfoliate to heart rate, and I'll explain that in a little more detail. So the weather has changed. We're going from a very sunny, lots of sun, lots of heat exposure, to a much more temperate climate, and with that our skin starts to change. So where our skin was glowing because we're getting high doses of vitamin D and we've got a little bit of sweat, it's humid, we're now going to a temperate climate that's colder. We're going from probably still warm to cold. It's not too cold outside, but the wind might start blowing. And what you're probably starting to notice is a variation in your skin. I think what a lot of patients are talking about, you wake up in the morning, you go to the bathroom mirror, what do you see there? You see patchy areas of pigmentation, some areas of skin starting to peel, and in some instances, skin is quite rough because of where it's become what we call keratinized, like the top layer of skin has started to overgrow a little bit with UV damage. So things like if you do have any skin tags or what we call solar keratosis, they're starting to feel a bit more bumpy. So what can we do about that? For once, I'm going to mention that you can exfoliate. You can do this at home. I sometimes say steer clear of physical exfoliants because they can aggravate the skin. But we have two great products in clinic. One is the Dr. Levy scrub and one is the Illumia scrub. So they both contain a combination of a physical scrub element with plant-based enzymes, or fruit-based enzymes, I should say, which help to soften the skin and then help to smooth out that rough layer. So imagine your skin is, you want it to be a flat road, but unfortunately it's very hilly at the moment because of exposure to sun or sun damage or whatever you're doing over the summer, and that can help. The next thing is to use toners that have maybe glycolic acid in them. Now, products that we don't use in clinic, Paula's Choice is a very popular one. There are salicylic toners as well, or fruit-based ones. However, in clinic, we have a lactic acid-based one. That's again from Illumia, or we have masks from Dr. Levy. For those of you who don't have time, like I haven't got time to do toning and cleansing and all those sort of things, we do very light grade peels to medium depth peels. Now, peels are very interesting, and I'm sure that some of you watching who've had peels have had variations of experiences. They generally work, they do work, but everyone's skin is different. So if you are interested in having a peel, a chemical-based peel, which is using acid-based technology to lift and exfoliate the skin, just have a little bit of a brief discussion. Obviously, this is the whole point of the video. This would involve, normally I'd get you into clinic and consult, but essentially what these peels are doing is they're penetrating through the top layer of skin and they're increasing cell turnover. Any damaged areas of skin, a damaged body recognizes that and gets rid of it, and then what that leaves is smooth skin underneath. So for example, with the glycolic-based peels, like from the Astrata or Illumia, you just get that smoothing and plumping effect. But if we use the medium depth peel, it can leave you quite red for a few hours, and then maybe 2-3 days later, you will start peeling. Depends on how well that product has penetrated in. And we have a peel called Skin Tech TCA, and we also have something called Perfect Peel coming into clinic very soon to tackle those very issues. Of course, we have IPL, which I spoke about last week. So anyway, that was exfoliation. I think, if you're starting off with your skincare regime this week, then add in a little bit of exfoliation. Don't go crazy. Use it maybe 2 to 3 times per week in the evening, and then moisturize afterwards. Really help to replenish the skin. Again, you could use a very plentiful moisturizer. I think moisturizer like CeraVe, Ceramide, or we have Recovery Balm, or we have Teoxane. There are so many, but if you'd like to know some information, just drop us an email. What am I talking about? Heart rate. So some of you have been coming in for your wrinkle smoothing relaxing treatments or dermal fillers. We've been doing pulse and blood pressure at the same time. So what I'm trying to do is combine my knowledge as a GP and make it a bit more standardized when you come in. Look, you come in maybe 2 to 3 times a year, maybe 4 times a year to have treatments. And, I see you more than your own GP does. So my focus is obviously your health, women's health predominantly. We do see men as well, but women's health predominantly. And, women's health is done not very well. We do try hard in the NHS. Obviously, I work in the NHS once a week. We do try very hard. It's very limited time, and it's more about disease management. And I want you as patients to have that education, have the opportunity to intervene when you want to. So exfoliation to heart rate is the tagline today. Now, going back to the topic that I mentioned at the beginning. So I spoke about tachyphylaxis with HRT. So tachyphylaxis is a condition or a syndrome that is a response to a previously effective treatment. So essentially, you have increasing levels of a drug, medication, and despite the increasing levels, where it was effective before, it no longer is. In fact, you start to experience adverse events. Now, perimenopause and menopause management, I mean, it's very much in vogue, very much on trend, thanks to great work from the likes of Louise Newson and Davina McCall. It's very much at the forefront. That's why GPs like me are now really trying to tackle this, because we're recognizing that it's not done well at all. Some of you may be watching this asking, well, why are you doing perimenopause and menopause management in clinic? Well, we are. Every time you come in, we are talking about it, and if you don't want to talk about it, you want to talk about something else, that's fine. But we're tackling it, we're talking about it, we're educating it. So alongside your wrinkle relaxing injection treatments, your aesthetic treatments, your skin treatments, we're starting to have that conversation. Of course, we will be bringing those sort of formal consultations. And in fact, if you do want to book in for a perimenopause or menopause discussion, then book in for a clinic slot. I'm more than happy to talk about it more formally. And in time, we'll be starting to talk about management. And that's the crux of it. Clinics or clinicians or non-clinicians are cropping up everywhere, offering HRT or perimenopause, menopause management. So that's why it's important to discuss something like tachyphylaxis. So what we're starting to notice, this is from the British Menopause Society, who summarized it, hence why I'm sharing it with you, is that increasing levels of estrogen are being prescribed. And in some cases, that's needed because not everyone absorbs estrogen in the same way. And whether it's through the skin, in a patch or in a gel, generally when you take it in a tablet form, it is absorbed better. So you may not be getting the response that you want from HRT. It may not be helping with your menopausal symptoms. So what happens is we increase that prescription, we increase the dose of estrogen. And for some women, you start to experience something called tachyphylaxis, where the estrogen was effective at first, it no longer is. So what's happening is you're getting these increasing levels of estrogen, and when we do blood tests, which we can do in clinic here at Vysana, you've got high levels of systemic estrogen, but you're still experiencing menopausal symptoms. So that can lead to adverse things like your mood being affected. So mood and anxiety are one of those things that are affected significantly in menopause, and then HRT has been shown to help improve that. But with increasing levels of estrogen, with tachyphylaxis, with the reverse happening where it was affected before and now you're no longer getting that effect, but you still got high levels of estrogen, that can affect your mood and give you increased anxiety. So I hope that was useful. That was tachyphylaxis with HRT, a known syndromic condition, and that's why we need to spend time exploring what's happening with the symptoms, and we do that anyway when you're coming in. So if you are on HRT, you're thinking about HRT or considering HRT, then when you do come into clinic, we will always talk about perimenopause and menopause management, and in time we can help guide you. I can help you guide you on that journey. If you are interested in a blood test, we have blood panels which cover everything. And obviously, if you're in perimenopause and you want to get an understanding of your hormonal levels, we can do that as well. So that was this week's newsletter. I hope it was interesting, from exfoliation to heart rate to tachyphylaxis with HRT. Thanks very much for watching. I hope it's useful. Please do comment, please do share, and I hope these newsletters are useful. Thanks very much. I'm Dr. Sunny. Bye-bye.